Just last week, I had a patient come in and ask me for more of an anime eye, and she couldn't figure out why it's not possible.
An anime eye, did you say?
Yes, to have her eyes made like roughly 3 times larger than what she already had or what she currently had. And that's just one of the things. It all comes from a self-absorption. Well, you can call it an obsession sometimes. It first started, with looking at yourself in the mirror and looking at photographs, then digital photography and being able to manipulate things on applications. The selfie generation, we had a different set of adjustments that were being done, and now we have applications that can even make you look like an animal.
Dr. Chiu, what's your... I'm sure we don't have people making requests to get bunny ears, but Dr. Chiu, what is the ethics behind this? I mean, if someone comes in making a request based on social media style, pressure, or influences, do you go ahead and do the surgery? Or is there a long consultation where you at first instance try and warn them off this?
Yes, of course. That's one of the things that we have to do as doctors is we go ahead and consult with them and try to figure out why it is that they're looking for these changes. Most of the time, it's not something that's reasonable when it comes to these very specific little changes. Used to be that people would come in asking to have a nose looking more like their favorite actor or actress, and now because of being able to do this with just a simple swipe, they think that it's something that can easily be done, when the fact of the matter is that they forget that there is time involved in the healing process, in doing the surgery, the costs that they're talking about to go ahead and do these different things. And when we think about cosmetic surgery, we want to have an improvement of ourselves, not a complete change into something that is unrealistic.
You're not a psychiatrist, right? You're a surgeon. I mean...
Absolutely, but the fact of the matter is that we sometimes have to play psychologist to our patients, because we have to, well, of course you've heard of body dysmorphic disorder, and this is just another variation, and they're calling it now.
I'm not allowed to ask Wilfred if he can make me look like this all the time?
But Dr. Chiu, my important follow-up is whether or not you, therefore, given all of what you're saying, think that social media is having a disproportionately negative impact on the life of youngsters, to have to push them to want to do these life-altering procedures, and we've just seen the prices of them flashed up on the screen, $20,000, $30,000.
Yes, well, like you said before, we have to discuss these things with them and make them understand that a lot of the requests are unrealistic, and of course, we don't go ahead and move forward with surgery. Even the ASPS will say that 1/3 of all requests for surgery you want to say no to. And when it comes to patients who want these different things, we just have to try to educate them on what is possible, what isn't possible, and what the best thing to do is. And sometimes it's just to go ahead and continue with these changes that they're doing with a swipe. The fact of the matter is that I don't think it's going to change.
Dr. Chiu, the one price we haven't got, how much are the bunny ears?
I want this.
How much does that cost?
Well, it'll look like this all the time.
Well, if you go down to the 99-cent store, it's 99 cents, Wilfred.
I think that's the way forward.